Meanwhile, the demand for COVID tests is increasing due to the rising numbers we've been seeing lately. But can the state keep up, or will Hawaii see a shortage of tests? Jen Beniza reports.
At-home COVID tests similar to this one that can be purchased in most drugstores, as well as other rapid antigen tests, are in high demand. And officials say they're also going to be harder to come by in the coming weeks. COVID cases are soaring, and so is the demand for testing.
We're definitely seeing a large increase. We're probably at about 120% where volume increase compared to where we were at 2 weeks ago.
According to the Department of Health, the state is averaging 8,524 tests a day in the last week. It almost reached 11,000 tests Wednesday, the highest count since the pandemic started. Not far behind the number of tests taken when H3 was used as a testing site.
The incredible demand for testing. It's incredible. In fact, it's almost in excess of our ability to stay up with that.
More than 1,000 unvaccinated state workers and an unknown number of county workers will be required to test weekly. So what happens when businesses start requiring unvaccinated workers to provide negative COVID results? Could we run out of tests?
The point-of-care tests are becoming more and more popular and more widely distributed. But I think all across the country, there's a big demand for those testing supplies. And so we may be challenged with keeping up with the testing supplies.
Desmond says the state is doing what they can to keep up with supplies. But not all types of tests are scarce.
That there's a very big supply of the nucleic acid amplification test kits in our hospital and clinical laboratories.
Wazalewski says the nucleic acid amplification tests, or NAT test, along with PCR tests, are actually more accurate. But point-of-care and antigen tests are more popular.
It's cheaper, it's faster, but it catches the disease later, and there's definitely a lot more, false positive, false negative results. I would do PCR over antigen in those cases if you're testing people weekly, because once you catch them on the antigen test, the person most likely is further along in the disease, which means it could be more contagious.
He says you should ask what kind of test you're taking, and if an antigen test comes out negative, he recommends doing a PCR test just to be sure. Jen Beniza, KHON2 News, working for Hawaii.